shoulder or shoulder girdle right here, we know that your arm is not moving that great. So before we move with your arm, we want to work with your shoulder girdle, because all of these muscles are going to help or may inhibit some of the movement in your shoulder and your arm. So we want to work with your shoulder girdle first in order to strengthen that, and in order to make some things a little stronger, stretch out some things a little better first, and then we'll have a little bit better movement with your arm. We're going to use a technique called Pnf. It's proprioceptive neuromuscular facilitation, which means that I'm going to be working with your arm to help facilitate some motions in a diagonal pattern, again, to make you a little stronger. Okay? But before we do that, let me show you what we're going to do. Again, we're going to work for your shoulder girdle first, or your scapula. So I want you to take your shoulder and pull it towards your nose. And we're moving in the diagonal pattern. As opposed to going straight up like this here, we're going to pull the shoulder towards the nose. And then you're going to push back behind you, because I'll be standing behind you, but more so in a diagonal pattern. It'll make more sense once you're laying down. Okay? So that's called Scapula D1. We're going to be doing two patterns, but we want to work with one of the patterns called D1. All right? Now, after that, then I'm going to put a person in position. So I want you to lay down at the front, on your side, on your left side. Okay, so he's going to be facing away from me. Lift up your leg here.
You have a pillow first back.
He'll be good for you. Just bring your hips back and bring this leg more forward.
Yes, no coordination.
Like that. And then we're going to drape. What's the two reasons why we would want to drape?
Privacy.
Privacy and
Claudia Schiffer walks in,
comfort, temperature.
then we don't have to drape.
So we're going to work with his shoulder or shoulder girdle. Let's move your body back towards me right here. Good. Now, it says patient position. He's sidelined. Then it says draping. We did that. And then it says PTA positioning. If I'm doing D1, I should be facing the head. Now, here is the diagonal. All right, if I'm doing D2, there is the diagonal. So I want to stand in this diagonal right there. All right. All right, now, afterwards, it says manual contact. But before I do that, I want to do some passive motions first so that he can feel what I'm doing. So, Mr. Frank, what I asked you to do earlier is to bring your shoulder girdle or your shoulder towards your nose and then bring it back towards me. But I want you to rest his arm right there. Okay? So we're just going to bring it towards your nose and then bring it back towards me. All right? Then, after he somewhat has that concept, I'm going to put my hands in the right spot. Now, I want to put my hand right here, and I want you to pull towards your nose. Good. And I want you to push back towards me. Good. I want you to pull towards your nose. Good. And then push back towards me. Good. Now, notice I'm not doing this. All right. So I want to be here. So pull towards your nose.
So
good. And then push back towards me.
Should there be some trunk movement while he's doing this?
He might get a little bit, but I'm really asking for just this. Let's pull towards your nose. He's going to get a little bit, but he's not doing anything exaggerated that's making a difference. And then push back towards me.
the fingertips are like above the acromion, closer to the neck.
Above and on, let's say
Right on
the
the collar.
interior,
Collarbone.
deltoid,
Okay.
kind of like the pecs region right in here. All right. Now we want some quick stretch with it. However, as you're pulling up towards your head, just as you hear the word pull, I'm going to do a quick stretch in my direction. But regardless of what you feel me do, I still want you to pull towards your nose. And then likewise coming back towards me. All right? So I want you to pull your shoulder towards your nose. Good. Push back towards me. Good. Pull your shoulder towards your nose.
So you do it
Good.
just before.
Push back towards me. Now, of course, it's going to take some time for him to register to you right away because I'm really looking for him to. Right now, he's doing.
So you want them to be basically
It's gonna
spot
pretty much
on.
Spot on right now. It's
Right
going to
where
take
you-
it'll take a while for that
Right.
to happen, but that's what we're looking for. So pull your shoulder towards your nose. Good. Push back towards me. Good. Pull your shoulder towards your nose.
Okay.
Good. Push back towards me. That's slow reversal. So we did Scapula D1 with the technique of slow reversal. Okay? So let's try that. Let's bring all the chairs up the front.